What is biofilm? Biofilm is the bacterial burden that our patients have to deal with that's affecting their health. By addressing biofilm in your practice in a new way, you can really help some patients. You'll help all of your patients. When we reduce the bacterial burden on patients from their mouth, believe it or not, that really has a positive effect on their overall health. The portal of entry for about 5 or 6 bacteria are through the mouth, and they show up in biofilm. Oral biofilm is associated with some of the biggest diseases we find in our lives: heart disease, stroke, pneumonia, preterm low birth weight babies, and births. There was a gentleman that came to my practice about 2 years ago. Had no idea that he had any specific problem. He knew his gums were bleeding, and he knew that he had, not been to a dentist for some time. Had no idea that it was affecting him. He had been treatment planned and diagnosed with some pretty severe cardiovascular disease issues. He had elevated cholesterol, he had elevated LP plaque 2. He had no idea that there was an effect in his mouth. Now, we did salivary diagnostics. We determined that he had a rather large amount of PG, which is Porphyromonas gingivalis. If you have PG present, you are 13 times more likely to have a heart attack in your life. Well, he was walking around, his physician is telling him he is prone to having a heart attack in the very short term. We find out that one of the dental issues he had was directly involved with that. We did salivary diagnostics, like I said. We did traditional perio. We went ahead and added some of the antimicrobial approaches we use. We lasered, we used oxygenating trays. We went ahead and did some systemic antibiotics and, verified at the end of his care. Now we've got him on a maintenance program, and his LP plaque 2 has gone down. Numbers in general, his cholesterol numbers have gone down. His HDL has gone up drastically, which is a great win for him. We all remember back in dental school when we took microbiology. And some of us liked it more than others, but it was a tough subject. And to now, in our practices, think we have to go back to micro class is pretty tough. Just keep in touch. We'll do our best to help you with any of your questions.